So the big final thoughts here are that monitoring IEP progress is a process, not an event. And the ultimate reason we must make a commitment to this systematically monitor progress is so we can know if the instruction and supports we are providing to students is having the results we're looking for. Access, engagement, and progress in general education, instruction environments, and other activities. Now we're going to go through a few resources and additional content that was included as part of this webinar. One of the things that you might want to do when you're thinking about this in your districts and schools is how you might engage various educators in monitoring IEP goal progress. So depending on the student's needs and the goal, data may be collected in specific or varied environments. The goal identifies the target behavior. Data may be collected whenever the conditions of the goal are met. For example, if the goal is to increase reading fluency of a certain grade level text, then data may be collected whenever the student is orally reading that level text. If the student participates in reading in both general and special education environments, data could be collected in either environment by a general or special educator. Any educator who knows how to collect data related to a goal may collect the data. It does not need to be a particular special educator. So we encourage you to have these types of discussions when thinking about various educators who might monitor IEP goal progress. Another thought is to be thinking about how you might engage students in monitoring their progress toward goal achievement or their level of attainment. So we encourage teams to be thinking about students and one of the students' goals and thinking about how that student might be actively involved in collecting, analyzing, and sharing their own IEP goal data. We're always thinking of ways to involve students more in the IEP progress. Engaging students in monitoring their own progress can be a significant motivator, not to mention potentially a good way to work on applied math and reasoning skills. Students can be taught to tally and chart their own progress. Sitting down with the teacher to review progress regularly can help the students see the progress they are making. And even students with more severe disabilities can be involved in monitoring and reflecting on their own progress. So it's just a matter of how you make that information accessible to the student in the formats that will work best for them. Another further thought is thinking about those in leadership roles. What are those most important things that you can do in a leadership role, or you could do in a district to support the capacity to systemically monitor IEP goal progress, analyze and share progress data, and make instructional and IEP decisions in response to measurement of student progress? So really be thinking about those different ways. How do your teams have the knowledge, skills, or tools to do this properly? Do you need IEP software systems that can help this, or do you have something that's already working? How are teachers trained in that? How do you balance efficiency, monitoring progress, progress reporting, collaboration planning with teaching and learning? So there's a dance here. You want to make sure that we're actually getting time spent in teaching and learning, but having really efficient ways for monitoring and thinking about the data that we collect. And are your teams putting the cart before the horse? Are they spending a lot of time developing goals based on anecdotal or weak data and then deciding the method of measuring progress and when it will be reported to parents? Don't get caught in an Andrew F. situation. Progress monitoring is not an afterthought. You'd want your doctor to know if a medication was not working before or early on during treatment before symptoms got worse, wouldn't you? So the same thing can apply to education. We want to make sure that what we're putting together has a plan for working. So this slide is a behavior example that we did not include in the original webinar, but it's just another supplementary example to go along with the resources as part of this webinar. In this example, we can see how the team analyzed one of the effects of the student's disability that results in the student leaving or being removed from class. Removals for behavior reasons is one of the most common reasons students miss instruction. For a student with a disability, even short removals can affect academic progress and social emotional development. In this example, the IEP team identified that the behaviors that most often resulted in the student wanting to leave class or being removed most often occurred when the student became overwhelmed by stimulation and in certain settings. When academic or behavior demands were added to this, the student became even less able to access and engage in activities in that general education environment. So the IEP team determined the student needed to develop better skills to manage their awareness of and response to the types of stimulation they regularly encounter in general education. One would also assume that in addition to directly working on the student's skill, the student's IEP would also identify or specify supports in the classroom to reduce social and emotional needs, as well as environmental barriers to access and engagement. Here's an example of a goal statement for this same student in the previous example. This goal statement only identifies the target behavior to improve anxiety and frustration management strategies and the related objectives. It is not a complete goal because it does not include a baseline or level of attainment. Data. That will come later. First, we need to make sure we have a target behavior or skills that directly relates to the disability-related need and that can be measured. In this example, the team decided objectives were needed to operationalize improving anxiety and frustration management. The team that developed this goal knew that it was not enough just to measure increased time engaged in classroom instruction. They also wanted to make a clear link between the root cause and the related disability-related need, which is difficulty with anxiety and frustration management due to trouble accurately identifying triggers and developing and using management strategies, and the effect, which is removal from classroom activities. You can see that the goal is stated in positive terms of what the student will do versus what the student won't do. So one of the pieces around this is just really making sure that when we develop goals, we're developing the goal around a skill that we are going to improve and increase. It's sometimes not enough just to measure the effect of the disability or the behavior output. You certainly want to keep track of that and have that information. It may show up as an additional measure, or it might be something that you refer to in your present level. But we always suggest developing good goals is going to be around a skill that is going to be increased in that student. All right. So this is just another follow-up activity that school staff can do or with their district and school staff once you are kind of thinking through how you want to utilize these processes. So take a look at your IEP goals in your current IEPs. You could do this around a staff training or a meeting or a group of teacher teams working across grade level. And for each goal, ask yourself, if we follow the procedures for measuring the student's progress toward meeting the annual goal as written, will we know if the student has made sufficient progress and be able to report the degree of progress during each reporting period? If we were to develop this IEP again, how might we revise the goal statement or stated progress measurement procedures to more effectively monitor ongoing progress toward IEP goal attainment? Of course, before you would change the IEP, you would make sure to have an IEP meeting to revise that IEP with all members, including the parent, available. So try using these checklists to reflect on your current IEPs and when drafting future IEP goals and progress monitoring procedures. We want to get into some additional resources at this point. There are so many rich resources on our CCRIEP Learning Resources page. There are additional resources on screening and progress monitoring from the Wisconsin RTI Center. There's some great national resources from the National Center for Response to Intervention on their progress monitoring page, as well as the Iowa Department of Education has some progress monitoring procedures that we think you should check out. Other national resources can be found from the National Center on Intensive Interventions. Wisconsin's Framework for an Equitable Multi-Systems of Supports is another Wisconsin resource that really lays out, if you're going to do anything like implement a system for progress monitoring, those key systems features that are part of an equitable multi-level system of support can be extremely useful in thinking through all the pieces that need to be in place to implement an effective system. We strongly recommend also looking at the culture responsive practices work that we have here through the department and the Wisconsin Strategic Assessment Systems for additional resources and information. If you want to look at some information on the DPI forms page on our sample forms, there's some links on this page that really give you some specific guidance related to the I-4 linking form, as well as the interim review of IEP goals, which is the I-6, and the annual review of IEP goals, I-5. So in our forms, sample forms guide, there's specific additional directions. On this slide are links to a number of related DPI initiatives aimed at these intents. When you click on each picture, it will take you to the web page for that initiative. So thank you again. Thank you to our speakers. Special thank you to everyone who's taken part in the live and recorded webinar. Take care.